going to be talking about, diabetes, type 2 diabetes. So let's just start from the basics of what is type 2 diabetes and what are the causes and the signs on diabetes type 2.
Yes. So because there's various educational levels, I think joining us, I'm going to try to keep it on a low level. We can always go in depth, but I want to include as many people as possible. So type 2 diabetes is known as an insulin resistant type of diabetes where the cell is unable to take in the insulin. So insulin is needed to shuttle glucose into the cells. So it's called insulin resistant diabetes. Basically, the cells have become immune to insulin. The body initially increases the amount of insulin to try to get through. And when that doesn't work, then what happens is the patient's blood sugar goes up and there's less sugar inside the cell.
So is type 2 diabetes genetic, or is it, being inherited?
It's debatable. Type 1 is thought to be genetic for sure. Type 2, I think we're seeing is it may be autoimmune. Okay, so it's a little controversial and it's kind of newer science, but some patients have a limited ability to be able to take in the insulin into the cell. So I'm not sure there's a gene type associated with it, but certainly a patient's genotype does have a role in that. I think you can say that it's not caused by a gene mutation, so it's not that type of genetic. But the genes are more pliable than what we gave them credit for. So there is a genetic component to it, but I wouldn't say an inherited direct gene autosomal dominant or recessive transmission.
Yeah. So let's say, you talked about the insulin levels and the blood sugar levels. So let's say if an average person hasn't gotten a test done yet, what would be the first signs that person would experience that could lead to a diabetes type 2?
So the thing about diabetes and the reason it's become so prevalent in the United States, especially in the Western world, now in China, we know in China it's higher as well, and other places that follow a Western type of lifestyle. So the issue with diabetes is usually it's about 10 years between initiation of symptoms and full diagnosis. And that's why we at the Bay Area Wellness Center in Burlingame, we do very early testing for that. So the first sign of diabetes in most cases is not an elevated A1C, which is the typical test they do that shows your 3-month level of blood sugar. The first sign is after meals, a patient can't get their blood sugar down. So again, because of the insulin resistance, now there's a large amount of blood sugar since the patient's eating food and the food breaks down to sugar. Typically insulin released and the insulin shuttles the blood sugar into the cells where it takes care of action, provides energy, and so on and so forth. In type 2 diabetes, you have all this sugar outside the cell in the bloodstream waiting into the cell, but it's like there's a roadblock. You can't get into the cell. So the body says, what's going on? So it releases more insulin to try to overcome this, and then more insulin. So the first thing would be a postprandial blood sugar. This is not always the case. I'm giving generalities. There are exceptions every day, but just to make it kind of simple. So we'd see in a glucose tolerance test, you'd see elevated blood sugars 1 or 2 hours after the meal. So that suggests that the insulin we have is not able to effectively bring down the blood sugar in the blood and get sugar shuttled into the cells.
Got it.
So,
now, before they come to you, is that person going to feel fatigue? That's what I was trying to understand. What are the symptoms that person is going to say? Oh, now my blood sugar is shot up, and then they say, oh, I need to go and see Dr. Frank or someone. So what kind of symptoms are they going to start feeling?
So there's a difference. So in our clinic, we test for things that'll show diabetes is coming on in 5 to 10 years. But let's say a patient is new to me
Okay.
And they come in for the full diabetic workup. So they may say, you know what, I find myself peeing a lot. I don't know why, but I don't think I have an infection. It looks clear, but I'm peeing all the time. So that would be one. The other thing would be, like you said, generalized fatigue. Patient says, I don't seem to, don't have the energy. I eat my lunch, and then an hour later I have to sleep. So what happens is, remember we talked about that the blood sugar, insulin is elevated to try to get more sugar. So what happens, it overshoots the mark. So you go from a very high blood sugar, 160, 170, and then the body secretes so much insulin to try to do its job. It takes it down to, 80 or 85, and the patient or the person 1 or 2 hours after the meal, then he feels somnolent. So one of them is they'll say, about 2:00, I need to take some candy, or I need to take a cup of coffee or a Red Bull because I'm gonna fall asleep. And that's because there's a friability where the patient's blood sugars are not regulated on a small variation. It's a high variation. You go from really high to really low. And when that happens, you go to the low phase, the patient feels really tired. So we have to work with that. So those are the things we see. And then there's other issues as well, but those are some of the major ones we see.